We're going to start off this video lecture series of our introduction to anesthesia by first defining what exactly is anesthesia. It's a question that's easier to ask than to answer. What is anesthesia? But I'm going to try to break it down to its most basic components. And the way that I like to think about what anesthesia is, it involves a couple of different things. So I think about anesthesia from an abstract point of view as a triangle. And anesthesia requires each one of these points in order to essentially be defined as anesthesia. So what do you want to do when a patient gets surgery? When a patient has surgery, how do you want to control the patient's pain? How do you want to make sure that the patient doesn't move? So all of those comprise this total or this grand definition of what anesthesia is. So let's get right down to it. So I like to think of anesthesia as the first thing is I want to make sure that the patient does not remember their surgery. Or you want to make sure that the patient is unaware or unconscious. So the first triangle, anesthesia, involves amnesia or forgetfulness. And in addition to that, I usually put unconsciousness here at the top point as well. And the unconsciousness, this is reversible unconsciousness. The second triangle, or the second point in the triangle here, is, well, you have the patient not remembering their surgery, they're asleep, but what happens when they wake up? They're going to really feel the surgery that they just had. So they're going to be in a lot of pain. So the next component of anesthesia is providing adequate pain relief, or analgesia. And then the third component of anesthesia has to do while they're undergoing surgery. When the surgeon makes the incision, you want that patient not to respond to a surgical stimulus like incision or cutting or suturing, things like that. So you want to make sure that the patient is not moving, or in other words, you want to make them akinetic. So akinesia is the third point of the anesthesia triangle. And akinesia comprises two different things. You can either have the patient be fully paralyzed, or in other words, provide muscle paralysis, or you can just have the patient have deep enough unconsciousness where they do not move or do not get stimulated. So I'll put or non-responsive to stimulus. So let's get into a couple of examples of the medications that we use that help or that fall into each of these three categories. So let's start with analgesia. So with analgesia, you can think of your opioids. These fall under this point of the triangle. You can think of NSAIDs, anything that essentially helps with pain control. You can think of your local anesthetics, and etc. Your akinesia, if you're thinking about completely paralyzing the patient or making their muscles totally relaxed, then that falls into the category of your depolarizing and your non-depolarizing neuromuscular blockers. And we'll get into the mechanisms and the types of medications that we use in another video. And then if you want to provide amnesia and a state of unconsciousness, your medications, such as propofol, fall under this category. Propofol, etomidate, your benzodiazepines, your barbiturates, your volatile anesthetics or your gases, all of those fall under amnesia and unconsciousness, and I put them along this line connecting amnesia to akinesia, because although they don't fully paralyze the patient as much as these depolarizing and non-depolarizing neuromuscular blockers, what they do is they assist in providing a non-responsive state to surgical stimulus. So that's why I didn't put them right up here at this point in the triangle. I put them along this spectrum where amnesia / unconsciousness has a component of akinesia, very loosely akinesia, more specifically not responding to a surgical stimulus. And those are the three big pillars of anesthesia.